Good morning, everyone. Good morning. I'm Dr. Randall Maxey, and my co-host, as usual, are Dr. Neighbor, who will be with us by audio this afternoon, Dr. Ivan Walks, and Dr. Jocelyn Hines. Today is a very special day for me, and that two of my personal heroes are on the line. Not that other people aren't my heroes, but when I was a student at the College of Pharmacy, University of Cincinnati, years ago, one of the lady who was the president of the Cincinnati Lynx presented a program every year. And that program was called the College Jamboree. And the first speaker historically of that program was a lady named Melba Merritt, who at that time was a student, the first Black female student, I believe, at the University of Cincinnati College of Medicine. The following year, and I'm going to take a social liberty, another Black female medical student who looked sort of like Lena Horne came and gave this exciting lecture that made me decide I wanted to go into medicine. She later became a hematologist. She later became a specialist in sickle cell. And then eventually she was named director of HRSA, which is one of the largest divisions of the federal government. And when she retired, she was I believe, a 2-star admiral in the public health service. And that's Dr. Marilyn Gaston, who's with us today. And Marilyn, I salute you, and we all do, and thank you for your wonderful career. Also, another person that I met when I was a sophomore in medical school, and I claim him as my mentor, and his name is Dr. Richard Allen Williams. Richard recruited me, along with a few others, with the Boston Recruitment Council. He was at that time the Associate Dean of the College of Medicine at Harvard University to interview for my internship. And he's been my guide since then and actually allowed me to publish my first major article as a sub-author of his book called Black-Related Diseases. And we're going to enjoy the program that he put together today on the health of on the heart health of Black women. He also is the 117th president of the National Medical Association. He's the founder of the Association of Black Cardiologists, and currently still is the CEO of the Minority Health Institute. We have a lot of information this morning. I first just want to give a few statistics, and hopefully Dr. Walks and Dr. Hines will be with us. Can you bring up the slide deck, Simon, please? And go to the next slide. So the total cases in the past 30 days take us to 78,269,789,000 cases in the United States, with a total deaths in the past 30 days of 930,811. And the community transmission is still high. Our theme has been for the past several months, use common sense. This pandemic, some people are saying it's becoming endemic, but we believe because there's such a high degree of vulnerability in communities of color, you should still make sure you wash your hands, socially distance, and remember what Dr. Salafu said, that Omicron itself can go as much as 30 to 60 feet in transmission. So the 6 feet social distancing may not be enough. We still believe that in enclosed places inside, Wearing a mask would be judicious. We believe you can go without a mask when you're outside, but you still remember if you watch people either smoke a cigarette or their breath fogs in cold, that when you walk through that fog or that smoke, that Omicron can still be in that pathway. So I think it's prudent to wear a mask anytime you're around other people. We think you should eat healthy, be healthy, and that's what we're going to talk about today. So without further ado, is Dr. Walks on? If not, we're going to go straight to my number one hero, Dr. Richard Williams, and I want you to introduce yourself and the other members of your team for today. And we will go with heart health of Black women. And why is that so important, Dr. Williams?
First of all, thank you very much, Dr. Maxey, for inviting me to be on. And I hope everybody can hear me and see me. Is that correct?
Yes.
Very good. I wanted to give credit to you and to the Black Health Trust for putting this program on and this series of programs, which have been going on now for, I guess it's about 2 years. Is that correct?
Correct.
Right. And more people need to know about it and need to know about you and what you're trying to do to bring credibility to health delivery and those who deliver the health to our people. And that's a matter of trust and truth. And that's where we're coming from today. I'm very proud to be here to talk to you today about heart health during Heart Month. February is Heart Month, and it's also Black History Month. So we're able to join those things together to bring you a presentation which is all very fitting, especially since we're going to be focusing on Black women and their heart health. And I hope many Black women are tuned into this, or if they're not, that they'll spread the word about what we're going to be talking about today. Black women, as I'm going to indicate in one of the slides that I'll show in a moment, are truly our national treasure. And we must make sure that everybody, and I mean everybody, recognizes that, because the fact of the matter is that that is not widely enough recognized. We, and I include we as all men especially, but also women, need to make that a big issue in many ways. One of the ways is by emphasizing the importance of controlling the greatest killer of mankind, and that's heart disease. And by recognizing the fact that Black women are particularly impacted by heart disease more than any other sex or gender group. That needs to be recognized. And also that, as I'll show you, heart disease is the most important of all of the diseases that we have to encounter. We brought that to attention in the textbook of Black-related diseases, which I published many years ago, and which, by the way, is now a part of the Smithsonian Institution. I'm very proud of that. The only book written by a Black doctor that has been admitted to the archives of the Smithsonian Institution. We now have 2 books. Also, Blacks in Medicine has recently been included in those archives. But to get back to the main issue, and that is the heart health of Black women, we have to recognize that Black women are our queens, and we have to treat them as such in all respects, in respect to how we consider them and regard them and handle them and respect them and treat them as far as health problems are concerned, and recognize that Black women are not just a female version of Black men or of men in general. They have their own characteristics, which I'll describe especially in regards to heart disease. And those have to be recognized. I want to make a particular point that the points that I'm going to be making about heart health of Black women are not generally taught in medical schools or to doctors who practice among Black women. And that's extremely important. When I was learning cardiology at Harvard Medical School many years ago, I was given the opportunity to talk to the gentleman who was considered the greatest cardiologist of his time, and that was Dr. Paul Dudley White. He was one of my professors at Harvard Medical School. And I had a private audience with him, and he asked me what I wanted to know about heart trouble that he could teach me. And I said, well, Dr. White, I'm a Black doctor who is very interested in the health of my people and the heart health in particular. Can you enlighten me on what is known about heart disease in Black people? He said, well, we don't really know very much, Williams. He said, all I can tell you is that we don't think that heart disease is a big issue in Black folks. And he used this expression. He said, the purebred Black person, or the purebred Negro, as he described it at that time, does not have typical heart attacks like white people do. I said, oh, really? He said, no, in fact, I teach all of the doctors that if a Black person comes into the emergency room complaining of chest pain, that they should consider that that chest pain is not really coming from the heart. It's probably coming from the stomach, or it may be due to gastrointestinal upset or something of that sort. And you should just give them a little heart soothing, or rather stomach soothing medication, and send them on their way, something like Tums or something of that sort. And that was what was taught at that time, that heart attacks were not a problem for Black people. And a lot of doctors believed that because they were being taught by the greatest people in the field at that time. And a lot of Black people suffered because when they were told that they didn't have heart attacks, weren't having a heart attack, they would go home and take that Tums, which didn't do any good, and curl up in their bed and die. That was a disaster. We subsequently discovered, after I started the Association of Black Cardiologists, that Black people indeed do have a significant amount of heart disease and heart attacks. And in fact, we have accumulated statistics that show that we have more heart trouble than anybody else on the planet. And that has to be recognized, and it's part of why I'm coming to you today during Black History Month and during Heart Health Month to make these points that you're not going to hear anywhere else. And I, again, come back to Dr. Maxey for giving him credit for hosting this program that allows us to bring the truth to you and let you know that we are telling you that we know, as your doctors, the real deal as far as what is affecting your health and what is going to keep you, allow you to survive. So let's get right into it. I'd like to show my first slide. Well, this gives a little bit more of my background, which Dr. Maxey has gone through it indicates some books that I've published and so forth, and some disclosures are listed here. Next slide. We'll come back to Danielle's slide in a bit and spell her name correctly, and also Gerald Bryant's slide. This is the first of my slides. Now, this first portion of my talk is going to deal with some overarching aspects of heart disease. And I'm going to go through them very fast. And then I'm going to get into some particular aspects of heart disease in Black women. So this is all about living healthy. And these slides that I'm going to show are kind of garden variety slides from the American Heart Association. Next slide. And it'll tell you different things about the problem of cardiovascular disease as it is a barrier to health, which is certainly true. We've already indicated it's the greatest killer of mankind, bar none. And it is a bigger killer than the next 5 causes of death, including cancer and pulmonary disease and diabetes and all the rest. Keep going. Next slide. So this bears that out. It shows that heart disease and stroke remain the top causes of death in the United States. And this shows those curves. Next slide. Now, this is a very important slide. It shows the graphics that indicate that overall life expectancy is actually declining. We've had a concern about life expectancy as Black people because forever we've been suffering under the fact that we don't live as long as other people do. And so our life expectancy, if it declines, is a more serious matter to us than it is to anybody else. And that's certainly true now when we see, since COVID began, that life expectancy for the first time in history has declined 2 years after seeing gains over the last several years. Gains in life expectancy have fallen off by at least 2 years for the general population and about 3 years for Black people. So as they say, when white people get a cold, Black people get pneumonia, we always get the worst deal, so to speak, from everything that comes around. And so it is with life expectancy. The other thing that you need to know about this is that as far as causes of death are concerned, the third leading cause of death now is COVID. COVID-19 has crept up the statistical ladder to number 3 after heart disease and cancer. And so that indicates how important COVID is. Next slide. Now, you can build your own culture of health through using what we call life simple sevens. This comes from the American Heart Association, but keep in mind that this is a formula that we developed in the ABC, the Association of Black Cardiologists, and they, so to speak, borrowed it from us in the American Heart Association. In any event, the life simple sevens include stopping smoking, eat better, get active, lose weight, manage your blood pressure, control your cholesterol, and reduce blood sugar. So those are life's simple sevens. It's a little formula that is out there that you can use to focus on the most important risk factors that you need to reduce. Next, please. And eating a healthy diet is extremely important. Can't go into all the details about it, but this is something that you need to focus on, not only for your heart, but it's important for other aspects of life. For instance, a big study that was just done at Massachusetts General Hospital in Boston indicated that healthy foods, and especially vegetable-based diet, is very important from the standpoint of not only keeping you from developing COVID, but also keeping you from developing the most serious manifestations of COVID. That is a study that was recently released, and it indicates that dietary factors are of great influence and importance in managing COVID. Next, please. And this just carries that theme further forward. Continue, please. And you need to be aware of serving sizes. Doesn't mean that you can't eat meat, but you should be aware of the fact that the more and the bigger the serving size is, the bigger a risk it's going to be to your health. Next, please. Exercise and maintaining a healthy weight, very, very important. We often talk about the fact that the size of one's waist is a good parameter of whether or not you're going to have a heart attack. And actually, that's true. One of the things that I used to teach my residents was to make sure that they taught patients, especially Black patients, and especially Black women, that they have to keep that waist size down. If your waist size, just to give you a figure, exceeds 32 inches, you are at risk of having a serious cardiac event in the next 5 years. For a man, it's 36 inches. We get a little more leeway. But you got to keep that waist size down, and that has been shown to be a serious risk factor in regards to heart health. Next, please. Smoking is certainly an important risk factor. You shouldn't smoke. Don't smoke. If you already do smoke, stop it. And as far as Black women, as I'm going to show you in a moment, it's a particular risk factor. Smoking is something that is a big risk factor, an independent risk factor in and of itself for heart disease. But it's a big risk factor also because of the fact that in women, it erases the estrogen advantage that Black women and women in general have for preventing heart attacks. And what I mean is that it's estimated that women have a 10-year advantage on men over men in regards to when a heart attack might occur. So women get their heart attacks if they're going to get them, 10 years after men. And one of the reasons for that is what we call the estrogen advantage. Estrogen, theoretically at least, gives an advantage to women that men don't have, that men don't get. And that is eliminated if you smoke or if you have diabetes. And it certainly is terrible if you have diabetes and are a smoker. So I think you get the message on that. Next, please. You need to manage your blood pressure, cholesterol, and blood sugar, needless to say. We'll be able to go into a few more details about that a bit later. Next, please. And do you have high blood pressure? This is something that Dr. Marilyn Gaston and I, Dr. Gaston is on the call, and Dr. Maxey told you about the wonders of what she's done in the past. You may not know, but Dr. Gaston has weighed in quite a bit on women's health in general and heart health in particular. And she and I have recently worked on a proposal, actually a grant, which she received to study high blood pressure in Black women and the aspects of controlling high blood pressure in Black women. In any event, this slide shows the new guidelines for blood pressure. I'm not going to go into them in detail, but suffice it to say that within the last 5 years, we've gotten some new guidelines which have indicated that whatever you thought your blood pressure was before that might have been normal may not be normal now under the new guidance. And what that has done is included about 300,000 or more new people in general into the category of high blood pressure that weren't there before. And that's a good thing because it means that we're able to give more attention to people who need it. Now, I'm going to try to continue along very quickly from here on and to my conclusion so that we can get to our next very important speaker. Next, please. Dr. Danielle Delaney is going to talk more about stress in the heart. So I'm going to pass this one on, except to say that it's an extremely important factor, which often is not taken into consideration as far as heart disease is concerned. Next, please. Next slide. And continue on. Now, I want to talk for just about 5 minutes on heart health in Black women in particular. Next slide. And about some cardiovascular disparities. And this is what Black women need to know about heart disease. And this is what I call the heart of the matter. In fact, I wrote a book called The Heart of the Matter, which focuses on heart disease in Black women. I hope that you'll avail yourself of that one. Next, please. Few statistics about women. Women are half the world's population or more. They work 2/3 of the world's working hours, 2/3, receiving only 10% of the world's income from all that work, owning less than 1% of the world's property. So if anybody ever says that women are especially favored in our society, I can certainly prove them wrong on that. Next, please. Continue on. So, what are the dangerous risk factors for Black women? Let's focus particularly on this slide, which shows that if you have any two of these risk factors, you are in danger of a heart attack or a stroke. If you have high blood pressure, low good cholesterol or HDL, high triglycerides, impaired glucose metabolism, that is diabetes, and as I said, a large waist, your risk of heart attack or stroke is increased in obese women, especially by obese Black women, by 117%. It doesn't turn out that way in obese white women for reasons that we don't understand. Next, please. I'm going to pass this one by because it's very cluttered and hard to get through, but suffice it to say that there are significant differences between the symptoms that men and women experience in regards to heart attacks. And just to be a little more precise, men usually have pain in the center of the chest, which might radiate down the left arm, sometimes in the back, and sometimes in the jaw. Women may not have chest pain at all when they have their heart attack. And if they do, it's not of the same magnitude as it is in men. And so therefore it's sometimes said or thought that they're not really having a true heart attack, but they are. And they also may sometimes have what we call anginal equivalence. That would include shortness of breath, dizziness, nausea, and fatigue and lassitude. But nonetheless, they may still be having a heart attack. And that's extremely important to recognize because of the fact that women who experience symptoms like that need to get to medical attention right away. And bear in mind, therefore, that what men experience is not necessarily what women experience when they have heart attacks. Next, please. We'll pass by this. I've covered the fact that heart attacks are more greater magnitude as far as disease is concerned and causes of death than other conditions. And other risk factors for heart disease are listed here. Just focus particularly on overweight. About 80% of Black women are overweight. That doesn't mean obese, but it includes obesity. And that's something that needs to be reduced. It's a huge factor that not only presages heart disease, but other diseases such as cancer. Next, please. And this is the last slide that I'll show in regards to heart disease in Black women in particular. 40%, Black women have a 40% likelihood of having heart disease or stroke. I said 40%. And when it comes to Black women overall, which is something that Gerald Bryant will cover, we find that Black women over the age of 20 have a 50% or more likelihood of developing one of the big risk factors for heart attacks, which is hypertension. I'm going to stop at this point and we'll address any questions that you might have later on, but I want to be able to get to two other speakers that we have who are very significant. And I think that you'll enjoy and learn a great deal from their presentations. And Dr. Maxey, would you like to introduce our next speaker?
No, you go ahead.
Our next speaker is actually my daughter, Danielle Williams Delaney. And I see that Danielle is here now. Danielle can tell you more about her background than I can and her area of expertise. So Danielle, you're on.
Hi, everyone. I'm Danielle, Dr. Danielle Williams Delaney. I'm the proud daughter of Dr. Richard Allen Williams, and you are a national and international treasure, Dad. So thank you for saying Black women are a national treasure, as are you. I work in crisis counseling, crisis intervention, and I'm a specialist in addiction and trauma recovery. I'd like to talk to you today about the heart-brain connection and GAD, which is general anxiety disorder. I'll begin with a quote from Malcolm X. The most disrespected person in America is the Black woman. The most unprotected person in America is the Black woman. The most neglected person in America is the Black woman. It's unfortunate that these words resonate as much today as when he first spoke them in 1962. When discussing general anxiety disorder, we should be at the forefront because the fact is that we, Black women, carry a much heavier allostatic load than anyone else. And we have reason for that. We are vulnerable and unprotected. We continue to be awfully disrespected and often ignored and erased when it comes to activism against police brutality, or when it comes to giving us credit that is long, long overdue. We face institutional violence in healthcare, education, and employment, and our lives continue to be at far greater risk due to devaluation by others. Obviously, we are predisposed to general anxiety disorder. The heart pounding, insomnia, muscle tension, shortness of breath, and often an emotional response that mirrors actual grief. General anxiety disorder is very commonly addressed in my own private practice. It presents as a stressful barrier to peace and ease in our daily life and in our own skin. It can surface without warning and it can be completely debilitating. Even with utilizing lifestyle interventions and attempting to lower stress levels, that experience of a spike in adrenaline and cortisol is the big challenge to de-escalate, but it is not impossible. And knowing how poorly that it can affect our heart and our cardiovascular system is a call to action for every single one of us. This is a challenge to our livelihoods and to our very lives as professionals, as doctors, as business leaders, as creators, as well as partners, sisters, mothers, and daughters. In a newly published study, Dr. Olujimi Ajijola at the UCLA Cardiac Arrhythmia Center has accelerated subjects' heart rates, monitoring their brain activity using functional MRI. Dr. Ajijola said, and I quote, "What we are trying to probe is, does the ability to sense one's internal organs, for example, heart rate, and the intensity of these sensations differ between individuals with elevated anxiety and individuals without anxiety," end quote. In short, the answer to that is a resounding yes. This study will broaden our understanding of the brain-body or heart-brain interaction and connection. Such studies as this can and will further the non-invasive treatments. And this is very important for our health, as well as our self-perception and our emotional processing in our ventromedial prefrontal cortex that is adversely affected in general anxiety disorder. This dysregulation, to put it very simply to everyone, it will create heart disease in your body. This is good news that I can recommend a full medical workup with your own doctor, well as having zero stigma regarding going to therapy, as well as practicing what I call lifestyle medicine, which is getting what your brain and body need, much like my father, Richard Williams, was just speaking about, the healing foods, finding some joy, spirituality, and self-reflection. Find your own way to release the pressure, as our next speaker, Gerald Bryant, will elaborate. And we Black women and men, we are descendants of queens and kings. Don't ever forget that. It's not just for Black History Month. Heavy is the head that wears the crown is such an accurate statement. But if we take proper note of our brain and how it reaches and touches our heart, we can help ourselves. Our soul and our body and our mind are forever intertwined and connected. We can always manage this heavy allostatic load, just like we rise above every other weapon formed against us as Black women. We are innovators. We are change agents. We are, and we will always be, grace under pressure. Thank you so much for having me here today. And I'll turn it over to our next speaker, Gerald Bryant.
Thank you to both Dr. Williams. You both did an excellent job with that. Thank you, Black Health Trust, for allowing us all to address you today. I have an MBA in healthcare management. I've spent the last 20 years in pharmaceutical sales, engaging with physicians and providing educational resources to help patients gain access to a wide variety of medications. Today, I'm going to talk with you about the action that has been taken and a call to action to all of you on the call today. I want to share with you how the Release the Pressure campaign is touching Black women across America to protect their Black girl magic by taking the pledge to protect their hearts and prioritize self-care and release the pressures that we all face as Black women in our lives every day. The Release the Pressure Coalition is inclusive of Minority Health Institute, which Dr. Williams is CEO and president, the Association of Black Cardiologists, the National Medical Association, the American Medical Association, the AMA Foundation, and the American Heart Association, organizations that are all deeply committed to improving the heart health of Black women. Some of the trusted Black female physician voices supporting the Release the Pressure campaign include Dr. Villanueva, the NMA president, Dr. Aletha Maybanks, the Chief Health Equity Officer of the AMA, Dr. Yolanda Dawson, and Dr. Patrice Harris, and many others if I neglect to acknowledge you today, I apologize. But there are many trusted voices that have helped to escalate this campaign. Just yesterday, Dr. Williams addressed the local Links Beverly Hills organization right here in our community. Dr. Villanueva addressed the Delta Research Foundation, and we've done many events just this month bringing this campaign awareness to the communities of Black women. So my call to action today is to invite everyone on the call today to take the pledge to commit to self-care at releasethepressure.org. And I put the website in the chat box already. This campaign is for any Black female over age 18 because, as Dr. Williams mentioned, more than 50% of Black women over age 20 have high blood pressure. And we can empower women to manage and learn with tools and resources to not only manage their blood pressure, but to release the pressure of all aspects of their lives, as Danielle discussed. It impacts us in many ways. The Release the Pressure campaign is entering year 3 with 54,000 pledges, but that's not enough. That's not nearly enough. And here's my call to action for Black Health Trust. We're inviting everyone on this call today to join this community and take the pledge today and commit to self-care and create your own community of Black women and share the information. If we change the health of one Black female, we can change a generation. So everyone on this call today can take the pledge, and men on this call, you can take the pledge and share it with every female in your lives, because you're going to help have an impact. There is content there on this website for all ages, millennials and all generations. There's someone for everyone. There's a patient and physician toolkit that can be shared with patients on how to properly measure their blood pressure at home, with a video entitled Real Talk About Blood Pressure. The content varies, with the physician having discussions on heart health, to nutrition, fitness, mindfulness, art and dance as ways to release the pressure, heart health summits, very engaging, Mother's Day summits. We've had virtual walking groups such as Girl Track, which is a national walking group. We've got tons of content. The physician toolkit, you can share that with your patients. That physician toolkit has information about how to teach patients about their numbers, how to take their blood pressure at home. I personally have benefited by taking my blood pressure and knowing that I should not drink coffee before I take my blood pressure, helping me to log my numbers so that I can share them. And that's what we want patients to do. We want them to create and commit to a goal with you, to learn how to log their blood pressure numbers and bring them into the office and share them with you. And I know many of you might think your patients probably don't have a blood pressure monitor, and we're working on that. We do have a campaign to try to find a manufacturer to make that available to patients. And now we're going to share, and I hope that Simon can share the video with you so that you can see some of the 2021 highlights of the Release the Pressure campaign and take a look at how we're creating Black girl magic all across America. If he can't share that, I posted the releasethepressure.org link in the chat, and you all can take a look at all of the work that we've done. Let's see if he can bring it up.
Okay, ladies, let's have a real talk about blood pressure. We have started.
Hello, all of you beautiful Black queens, as we kick off our inaugural Release the Pressure National Virtual Vision Board Party.
One of the ways that we can release the pressure is to just tune in to trusted voices, to folks who speak life and love into our lives every day.
Today, we are going to be spotlighting 5 dynamic Black women artists, and our conversation is about releasing the pressure, art as therapy for your heart.
I pride myself in creating a lot of affirmation art so that when you see it, you want to put it on your wall so you can wake up every day and say, okay, everything is going to be okay.
Happiest Mother's Day weekend.
We know, of course, that at the heart of prevention is knowledge, and knowledge is power.
Because of many women like you is the reason why I'm here today. Literally, because I trust them.
Self-care is not negotiable. It's not.
It is
healthy to put you first unapologetically so that you can be your best self.
It's a strong message and a true one at that. That's Stephanie Johnson, who works with the American Medical Association, and she wants women, especially Black women, to make self-care a top priority.
More than half of Black men and women have high blood pressure. Nearly 80% do not have their blood pressure under control. High-quality health care are not equally protective across race and gender groups. As many of you know, I recently had a stroke, and I'm on the comeback. And I've made it my mission to help as many others as I can on my journey back. That's why I came out of retirement to support the Release the Pressure campaign.
Health here is intrinsically connected to the rest of our health and our heart health.
First of all, let me just say it's an honor to partner with you on this journey to make sure that all people have a healthy heart, specifically women.
I want to share with you all one of my favorite recipes from WW, sheet pan salmon with crispy kale.
We are really excited to join with RTP and provide heart health to Black women all over this country.
In Washington, D.C., about a quarter of adults have hypertension. When we look at the Black community, we know that that number is twice as high.
You can take control. You can get your blood pressure down. Yes, you can. You can get it down.
Release the Pressure and all the organizations, AMA, AHA, coming together to really make a big difference. This is what we need, and so this is what this is all about.
You change one Black woman, you change the family,
yes.
You change the generation that comes from the family,
yes.
You change the community.
You are preaching, girl.
Just health-wise, I'm so grateful that I actually make sure that I go to the doctor and get checked all the time, so I know if there's any issues I need to address right away.
With Girl Trek, we say that walking is the simplest thing you can do to take care of your health. We have 1.5 million women walking across the planet.
We've been talking to the organization about ways we can show up for Black women in a way that has not been done in public-facing campaigns before.
Welcome to Ebony Community Connect.
We have the conversation about mental health, mental peace, and really detoxifying our life from a holistic perspective. Literally, we have to release the pressure.
We do. Ladies and gentlemen, join me in welcoming our 2021 Innovator of the Year Award winner, Dr. Kizzmekia Corbett.
I am the embodiment of what is bold and what is brilliant and what is Black.
Let's empower ourselves with knowing our blood pressure numbers and keeping ourselves healthy.
Be sure to take time each day to RTP and take care of your heart because y'all, your heart certainly takes care of you.
That heart you put into everything got you here, helped you do that and that. Protect your magic, protect your heart. Take the pledge to put your heart first.
Thank you, Black Health Trust. Please take the pledge.
Put your heart first. Thank you so much. Dr. Richard.
By the way, you can take that pledge right now. Isn't that right, Gerald? By going to
releasethepressure.org.
Releasethepressure.org. Releasethepressure.org takes you right to that website, and you can do the pledge right now. It only takes a few seconds, right while you're on this call.
The link is in the chat.
The link is in the chat. And we'd like for everybody.
There's a very great video. Dr. Richard Williams, I think there's a formula that you taught me saying that blood pressure equals heart rate times stroke volume towards times total peripheral resistance. So that made my pressure a little bit higher because it was so exciting and well done. That was great. That was great.
Well,
So
thank
very
you.
good. So there are a few questions in the chat. Dr. Walks, are you able to unmute yet?
I am able to unmute Dr. Maxey. Thank you. Dr. Williams and team, that was fabulous. Thank you so much.
Very good. There's a question in the chat about high cholesterol, in particular the LDL cholesterol. And you made a comment about HDL. Can you talk to lay people about the value of those two measurements and what they mean? And does the HDL equilibrate with level of exercise or amount of exercise?
Can I ask who asked that question?
I don't know.
That's a great question. Okay, we don't know. In any event, what you're referring to, what the questioner is referring to are two fractions of the lipids in the blood, or the fats in the blood. And the most important one from the standpoint of effects on the heart is the LDL, the low cholesterol. And its level is extremely important because of the fact that if it is high, it is consistent with the development of plaque in the blood vessels and can lead to heart attacks. The HDL, what we call the more protective aspect of those fractions, is at a certain level. If it's high enough, it is protective, and it tends to be higher in women, but in Black women, sometimes we see that the level is not quite sufficient to be protective. There are really no good, reliable methods of trying to stimulate its increase. It tends to be a genetically influenced factor. But suffice it to say that we use those fractions to determine some aspects of the heart health, and also use them as risk factors or predictors of future events as far as cardiovascular disease is concerned.
So Dr. Williams, in response to your question, that was Linda Hall, one of the folks that's with us pretty much every Sunday, who asked that. And I always think about it as, when you get your cholesterol numbers, you want the HDL to be high, H stands for high, and you want the LDL to be low, and L stands for low. See, I keep it about as simple as I can, sir.
Perfect. That's much better description than I gave.
Yeah.
Thanks, Dr.
Not at all.
So I've got two short questions before I turn it over to Dr. Walk. One is, why is waistline, waist size, so important, and why does it correlate with increased cardiac danger? That's one. And the other is towards Danielle, who also gave a beautiful presentation, and that is, why does stress and cortisol level, et cetera, affect your liability for heart attacks and heart disease? But first, Dr. Williams.
I'd like to defer to Danielle first to give her answer to that question about stress, and then I'll weigh in on the other question.
Stress and cortisol, stress causes your cortisol to rise, which then in turn makes you gain weight. And holding on to that stress and gaining weight, like my father will explain about the waistline, it increases our likelihood of stroke and heart attack. And also, I wanted to say, a lot of people are taking benzodiazepines or they're prescribed that for their anxiety and for general anxiety disorder. And those are meant for very short-term time periods, and they're extremely addictive. So a lot of people that are coming to me have been on them for such a long time period that they have to talk to their doctor and titrate gently and slowly off of them. It can't be abrupt, but what they do is they turn on you at some point as well. And they start to cause more anxiety and depression than they alleviate. So it's really not the solution to start taking medications for it either. So in order to lower cortisol and lower all of those factors, you really need to do lifestyle interventions, lifestyle medicine, taking care of yourself, meditation, releasethepressure.org, going to that and joining there so that you can take care of your physical health and take that pledge to take care of yourself. So that's really why the cortisol affects everything. It affects everything in your body.
So
And Dr.
I
Jasper has a question for Dr. Williams also. I see that.
Can I just jump in for a second? When
Yeah.
you say benzodiazepines, we're talking about Xanax and Ativan primarily. That's what you go see your doctor says, here, calm down, here's some Xanax, here's some Ativan. And I wholeheartedly agree with everything you just said. I want to make sure folks know what we're exactly.
And Valium, everything in that class, everything in the
Klonopin.
Yes, exactly. And the problem with them is you have to titrate very slowly, but they're extremely addictive. And in every polysubstance overdose that we hear of in the news, whether it's Michael Jackson and propofol, whether it's Anna Nicole and something else, or Heath Ledger, or any of these celebrity deaths, always in the toxicology screen, they don't mention it, and we just look at it, but benzodiazepine, some form is in there. And if you have that and mix it with alcohol, it suppresses breathing. So it can lead to death just right there. So it's very dangerous to take those in order to calm yourself down. And then also, like I said, they can eventually cause so much anxiety.
Yeah.
It's just not helpful in the long run. They're very short term.
Let me add to that. I think that topic is so important.
I do too.
There's a prohibition that people should know about taking those benzodiazepines and this cough syrup that everybody likes, which is promethazine with codeine. And in particular, opioids and benzodiazepines can severely depress respiration and lead to death. So I'm so glad you brought that up.
Thank you, Dr. Maxey. And all of these fentanyl overdoses, which is a national epidemic and crisis, has been quadrupled in the pandemic, and suicide rates are also up 200% during this pandemic. All of those overdoses, a lot of people pass around benzos like, hey, oh, you're having problems? How about you take a benzo? How about, I've got a Xanax, I've got a Valium. And you have no idea where they got it. You have no idea if it has fentanyl in it. And we're losing our young people across the country and all over the world at such a rapid rate. It's heartbreaking. And people need to be very, very aware of this. And I really feel like the opioid crisis, which is a crisis because it's white people, it's taken over the news, when really I think the next crisis is going to be benzos, and people overlook it. It's just missed in those polysubstance overdoses. So it's very important. Thank you.
Gee, I think we've gotten into a second area, which is extremely important for us to consider, and that's the area of opioid addiction and opioid use disorder. And I'd like to point out to everybody who doesn't know it that Dr. Ivan Walks is a psychiatrist and has considerable knowledge about this area, and also that Gerald Bryant is someone who has worked in this area. I wonder if either one of them has anything that they would like to say, not that it has to pertain to heart disease, but to the fact that opioid use disorder is extremely important from the standpoint that it is a huge cause of death among Black young people. In fact, it is the leading cause of death among Black young people in the United States today. And that's something that we need to recognize and to deal with. So I'm going to invite, if I can, Dr. Maxey, to get some comments from Dr. Walks and from Gerald Bryant in regards to that problem.
Good.
Thank you, Dr. Williams. For 8 years of my career, I promoted the medication buprenorphine, Suboxone, to help, create access for patients to get access to evidence-based medication to treat opiate use disorder. So I'm very familiar with the epidemic. And during the pandemic, we've lost a lot of Blacks specifically to the opioid crisis because we've all been, not engaged. Patients have not had access to their providers. They've been at home dealing with their mental health issues. And so we really have been impacted primarily with the opioid crisis. And you don't hear the numbers in the news as much as you hear, as Danielle mentioned. It's more of a white conversation, but Black people have severely been impacted by the opioid crisis, especially during the pandemic. And it's, there are medications available to treat opioid use disorder. Many of you might be on the call that I've helped become certified to address this crisis. So I'm definitely familiar with it. And then I'll let Danielle continue to address that as well.
Okay, I'm unmuted. I'm sorry, what was that, Gerald? If you could just repeat that last line, what you wanted me to help.
You could address the mental health component of the opioid crisis as you began to elaborate on and help our audience understand it from that perspective.
Right. It's well, this pandemic, people are isolated, people are lonely, people are using whatever they can, and anyone with an addiction problem. I work with a lot of those. There's maybe 70 rehab facilities out in Malibu, and I get all my referrals really directly from there. And people are taking these pills and they're alone in their homes and they're self-medicating their aches and their pains. And sometimes they've been given to them for something else, whether it was dental surgery, knee surgery, hip replacement, what have you. And it's disastrous because they are so extremely addictive. And all I can say is it is a horrible, horrible crisis, and it is underreported, and especially in our communities.
And I think the other thing I'd like to mention is that we all need to have naloxone in our homes. Naloxone is, if we have someone in our home that has an overdose, that's the one thing that we can have that could reverse an overdose. So we all need to know that we need to have naloxone readily available to reverse overdose. But the fentanyl issue has just really just taken it over the top in terms of the number of individuals that are overdosing because they thought they were taking something and that pill, had fentanyl in it, and they didn't know that they were putting fentanyl in their systems.
One really pill, and these kids can get them on the internet, and adults get them on the internet as well. But parents go into a child's room and they're dead, and they ordered it online, opened a package in their room, took a pill, and they're gone. So it's extreme. There's some questions, Dad, in the chat.
Before we go to those questions, I'd like to invite Dr. Walks to make some comments about this.
Richard, I want to go back to that waist size issue.
So Dr. Maxey, I'll make a couple of comments, and then I'm going to come back to the waist size issue that you had asked Dr. Williams to comment on. With respect to the opioid crisis and with respect to just how it's killing folks in our community, I'm an old person. I remember when, if you bought marijuana, you were buying marijuana. That's just what you were buying. You were getting what you thought you were getting. And I think what we don't educate people about enough is that you don't know what you're getting anymore. People are sprinkling this and lacing with that. And so you think you're buying one thing and somebody is trying to make their product better. They're trying to get you a little bit higher. They're trying to get you a little bit lower, a little bit more relaxed. And so, but they're not compound pharmacists. They don't measure exactly. And with something like fentanyl, a tiny amount that you can't even see is enough to kill you. And I think there's a disconnect with people not understanding exactly what they're getting. Most of these folks are not trying to die. They're trying to relax or get high or deal with some of the things that Dr. Williams Delaney talked about that are so challenging for us right now. So I think our conversations about this, I'm one of those docs that has my buprenorphine certification and does a lot of work with the addiction part of it, as well as with the mental health part of it. And they go together. I don't get high, not because I don't want to, but because I'm managing the other stuff, so I don't need to. I respect the fact that sometimes life can be overwhelming. And we live in a culture where we talk about, well, let me take a drink so I can either feel better or not feel bad, where I can take a pill. And we don't do enough of some of the stuff I think that Dr. Williams Delaney talked about, which is developing tools so we learn how to manage anxiety. And so we can actually begin to do the things that kind of boost our arsenal. What can we do when life comes at you? Because life will come at you. So I think these kinds of conversations matter a lot. Dr. Williams, I'm going to make Dr. Maxey's question a little bit harder, which is nothing for you. But this is something, and maybe Gerald Bryant can jump in on this too. We have tried in the past to talk about this weight thing. And in our society, in our culture today, you get a lot of trouble when people think you're trying to body shame. Don't you tell me I'm too big. Don't you tell me I should lose weight. Don't you say anything bad about how I look. But we know on the health side that statistics, data actually shows us that that 35-inch waist matters. So Dr. Williams, and maybe Gerald Bryant, with the wonderful marketing and messaging and all of that, how do we walk that line between giving people information that they need about their health and not getting in trouble? Because in our society today, don't you body shame anybody. Don't you tell me how do, and anybody, please help me with that, because I struggle with how do I get the message I need to get out without getting in trouble?
Well, first I'd like to say, send your patients to releasethepressure.org, because they will find tons of tools to introduce to them how walking, especially the girl track walking, is amazing. But you want to engage when you take a look at the content on releasethepressure.org. I happen to love the title of Mary J. Blige's new album, Good Morning Gorgeous. So there are ways to engage and have someone, really look forward to that conversation and learn ways to reduce their weight. Walking is the best thing, the simplest thing to do. So that's the first step. Ask them to do something simple, but tell them they're gorgeous while they're doing it.
Can I add to that as well? I think, and also Dr. Gaston has a question, and that's important. But I think also it's important, Dr. Walks, that there are people whose size, obviously this waist issue, we have to talk about that more, but their size, they may be very healthy. Mm-hmm. They need to see their doctor, their MD, who can do a complete physical and workup to find out what their blood pressure and cholesterol and heart rate, all of that is, because some larger people are larger people, and it's not so much about their appearance, it's about their internal organs and their heart function. So I think it's just making sure you don't stress that, well, you look too big, that it's not you, it's the usage of our words, and you're amazing with yours, obviously. So I doubt you'd find yourself getting in trouble, but you're right. It's a sensitive topic to tell people to lose weight. But I think we like to hear just, we need to reduce all of the things that are causing heart disease and issues within our body, but it may not necessarily be about how they appear.
Dr. Williams?
Yeah, I'd like to, before Dr. Gaston comes up, and I'd like to hear from her. As far as the waist question is concerned, before I go on to that, let me just say something about the body shaming or that aspect of things. When I was in my former life actively practicing medicine, and I encountered a large, wide body person, and they came to me and said, "Oh, I'm so ashamed of my weight. What can I do about it?" I wanted them to feel good, and I would tell them to let everybody know that you're proud of your size, and that you can say that there's just more to love, that your size is not an impediment to anything, and you should be proud of it. However, what goes along with that is a realization that size can matter from the standpoint of being not only a detriment to your heart health, but an actual risk factor, which can lead to death. And you have to be honest with people and let them know that if they intend to survive, that they've got to do something about a problem that they know they have, and you know they have, and work together with them on solving that problem. You got to get in partnership with the person to try to do something to help their own body. And that's not body shaming. That's being very realistic about something that can help them and can help them live longer. Now, as far as the weight problem or situation is concerned, I would like to mention, first of all, that there's a formula that we can use. It's a very complicated formula to determine what we call body mass index, BMI. BMI is a formula which consists of your weight in pounds divided, your weight in pounds divided by your height in inches squared, and then multiplied by 703. So you can see that that's a little complicated, but what that does is to come out to a number which should be between 18.9 and 24.9. If it's in that range, it's normal. If it's above that range, above 25, then that's abnormal. And if it gets to 30 or 32, it can be deadly. It correlates with increased mortality and morbidity and cardiac events. So
part of the reason, Richard, I wanted you to address, is that the same for Black populations as well as white, or is there any?
Excellent question. No, it's not. And let me explain that. When it was first devised, as is true with a lot of the metrics that we use, it was devised with white people being used as the template, so to speak, the people that were measured. And their characteristics, their body characteristics are distinctly different from other folks. And it doesn't apply equally to, for instance, Asians who tend to have smaller body mass, or to Black people who tend to have larger body mass. And so it needs to be adjusted and applied from the standpoint of the individuals that you're talking about, that you're treating. So for instance, if we used a BMI of 25 for a Black person and say that, and if we say that if they reach 26, that they're obese, that would not be absolutely true, because of the fact that their body mass is naturally larger than the body mass for some other individuals. So that comes back to waist size. Waist size is sort of a surrogate figure or metric for BMI. Everybody can't easily calculate their own BMI or body mass index. So we use waist size as an easy thing to measure to give you an idea of whether or not you are entering that danger zone. And so that's the reason that I said that if you have a certain waist size above that level, you are in danger of having a cardiac event in the next 5 years, and you need to get that waist size down. I hope that's clear.
So Dr. Gaston, we'd love to hear from you.
Oh, thank you so much. I'm delighted to be here. I can't tell you how excited I've been this whole past hour. Maybe it's an hour and a half now, but it's been wonderful. I've been excited. First of all, two of my main heroes in my career are here, Dr. Williams, and of course, you know who the other one is, the one that said that I was this, that, and the other, and Lena Horne, and my goodness, I'm sending you kisses. Thank you so much. But the discussion has been wonderful. So I have my two heroes. Now I have a shero in Danielle. And Danielle, I'm so proud to meet you and pleased, and I'm going to get your number and talk to you more, because the work you're doing is so, so important. And I'll come back to the stress issue in a minute. But since we're talking about the weight, it is a major issue for our Black women. And like you said, it's touchy. You don't want them to feel less than they are, less powerful, et cetera, et cetera. And then you have, comedians that say things like, if you're sitting next to a skinny woman, slap her. Have you heard, do you remember the comedian that would say things like that? So it's very difficult. We have addressed it in a number of ways. Well, first of all, for the past 20 years, I've been working with a clinical psychologist. And we have developed an intervention called Primetime Sister Circles that's focused on midlife Black women. And we have a database that's very large. And the two main top reasons for women to want to get into our intervention is number one, stress, and number two, obesity. And so they come to us wanting to deal with it. Now that gives us an advantage because I think it's difficult for a primary care provider who has overweight Black women to just mention it, like you said. How do you do that? So these women come in wanting to deal with their weight. And that gives us a head start. And so we're also dealing with teaching them their blood pressure. It's a holistic program. We deal not only with physical issues, we deal with emotional and mental issues, and we deal with spiritual issues. But once they go through the intensive period, which is about 3 months, and we have experts and facilitators, and Dr. Porter, the clinical psychologist, and I were in there. It's really, they're immersed totally in our program. And once they really, first of all, they have to start prioritizing their health, period, not just their weight. Like we said before, it has to be holistic. And once they do that, and once they're motivated, and once they have success, they're reading their own food labels. They're helping each other accomplish their goals. Once they get to that point, they're watching their diets. These women say, this program is something. I'm exercising, and I haven't exercised since I was in the 8th grade. And so it is doable. It takes patience and time, and it is work, but the reward is just wonderful. So we can't throw up our hands now. We get frustrated because some of them are so overweight. The average weight when they enter is 200 pounds. Okay. And, we are starting to talk to the head of Weight Watchers, the CEO of Weight Watchers. Oh, I just have to interrupt that for a minute. It took me to the fact that Dr. Porter and I, in our program, Primetime Sister Circles, got 2 major awards for the work we're doing in decreasing hypertension, the American Heart Association and the National Institutes of Health. We got this award last year for the work we're doing in decreasing their blood pressures. And so one of the awardees, there were 3 of us, and one of them was the CEO of Weight Watchers. So we're talking to her because getting that much weight off without some kind of intervention that might be surgical does take time and is hard. And so we're going to join with her. And I think we have a plan where we go in stages now, in stages where we really have to have some kind of intervention that gives them a jump on moving further with their weight. But anyway, I'm so glad to hear this discussion, and I'm so glad to hear the concern. And I think we need to make obesity in Black women a major issue, and maybe even have a campaign around that. And the stress is connected with that too, because all that weight is from emotional eating, from the stress, okay? So that is important also. So I can't even tell you what I'm so excited about. Now, one of the questions, Dr. Williams, I have for you is, we all know stress in our Black women is really important, not only for the obesity, the hypertension, and everything else. Why doesn't the Heart Association or the NMA decide that instead of the current Heart Association Life Simple 7, add Life's Simple 8 and add stress. Now, I have to share with you that I've talked to the leaders at AJ and presented that to them before. And they said, well, we don't think there's enough data that really says stress plays a role with heart disease. And I about fainted. But nevertheless, I think we need a plan to change that, the risk factors, and make sure that, and Danielle, we're gonna need your help to come with us to see them, okay?
Happy to do so.
In fact, I want Danielle to explain just in a lay term, allostatic load.
Yeah.
Allostatic load is the level of stress we carry. And as Black women, we have the highest allostatic load. As Black people, we have the highest allostatic load. And that overlaps with all manner of health troubles that we may have. And I also wanted to add that, with weight gain, sometimes there's other things at play, other factors at play, aside from overeating, aside from inactivity. There's thyroid disease. And so that's why I recommend always getting a full and complete total workup with your MD, because there's environmental factors at play going on these days that you can eat extremely healthy, but if you have certain conditions, you will continue to gain or have difficulty losing. And that has to be addressed before you can really address anything else. And also that people with thyroid disease are so often misdiagnosed by psychiatrists. And I know a few of you can say yes and concur with that they are given antidepressants or they are given benzodiazepines for anxiety when actually their problem is physical. So it's just so important to have the physical assessed and addressed before you even try anything else. And the allostatic load that we carry obviously contributes to all of it.
That's, Danielle, that's like what we used to say back in the old days. A patient would come to you and say, I'm concerned about being talked about regarding my weight. And I try to keep telling people that it's not because I'm eating so much, it's because I got a problem with my glands.
We hear that a lot too.
Yes.
So there's a question that Danielle.
I just wanted to add something about allostatic load, that the reason that it applies so much, that term applies to Black people, is because of our heritage and our history. It's something that derives from our history of slavery and going through Jim Crow and so on and so forth. It's the mental burden that is placed upon us by simply being Black in America.
And our
absolutely.
Genetic, yes.
So a lot of people on the line are going to go to their doctor this week. And in light of what you and Danielle and also Ms. Bryant are saying, what is the typical workup and some of the results you would want to see, Dr. Williams, when we order our Chem panel 14s, et cetera? Like, is CRP important? Is CPK important? What are the important things that we should ask for in terms of laboratory as opposed to just let the doctor do what he wants? What are some of the things we should look for in our workup that might point out stress, heart disease, and those things?
Well, I have to be careful with the answer to that because of the fact that there are regulatory agencies that are aligned with the federal government that look at us from the standpoint of how many lab tests we order and what the justification is for these lab tests. Suffice it to say that diseases cause certain physical and physiological problems within the human body. And those can be measured by doing certain lab tests. The government doesn't always agree that those tests are justified and will look very, very sternly at doctors who order too many of those, what we call biomarkers. In any event, there are some tests that give us an indication of the not only the presence of certain diseases within our body, but the severity of those diseases. And some of those markers, such as you mentioned, CRP, for instance, are measures of the presence of inflammation in the body. I personally feel that almost all diseases can be traced back to some aspect of inflammation. And I want to make sure that everybody understands that that is key, because if inflammation is a cause of disease within us, then the treatment of inflammation should get us beyond that disease. It should be looked at as something that is appropriate for treatment of, for instance, heart disease. And that's one of the reasons that certain new medications are being given, because they focus on the inflammatory aspect of coronary artery disease, which can lead to the rupture of plaque in the artery and obstruction and a heart attack. So
sorry.
Go right ahead.
May I also say that the stage of life matters as we're speaking about women. And I'm paying attention to Prime Time, Dr. Gaston's book about midlife wellness. And a big part of, thank you, a big piece of this can be perimenopause and menopause, as far as waist size, as far as thyroid disease, all of that. So when we're also talking about going to your doctor and having these panels done and complete medical workups, you do want to have a thyroid panel done and seeing your gynecologist. And certain stages of life, you're more predisposed toward weight gain, depression, anxiety, all of it. We're just lucky that way. And then we've also got this predisposition to many things because of what we carry in our DNA from our history. So that's just something I wanted to mention too.
Before we get off, I want to go, if I can, Dr. Maxey, just ask Dr. Gaston to elaborate a little bit more on some of the work that she has done and continues to do in regards to Black women with hypertension. And I've been fortunate and privileged to work with her on a couple of her projects. Could you describe those, please, Marilyn? They're extremely important in the setting that we're talking about.
Well, thank you. I'll make it as brief as I can. Were you on one of our calls recently when we really looked at the data in terms of the association of hypertension and depression in our women?
I don't think I was on that one, no.
Well, we need
Gerald Gaskin?
That was with Dr. Gaskin, yes, at
Uh-huh.
Hopkins. Yeah, we're doing this in conjunction with Johns Hopkins too.
Wait, I've been on many of those calls.
I know,
guys,
I know. Yeah, and you've been such a big help, and you've made a big difference for all of us, and thank you very much for it. But recently, we just finished the data looking at the mental health aspects of hypertension in our Black women, and the association is still just an association. We did not find any cause and effect, but we haven't really found that documented or reported frequently. Maybe all of you have. Maybe you have, Dr. Williams, that the people are finding an increased level of depression associated with hypertension. And so we're still not through with all the data. Well, I'll make sure you're on the next call we have about that.
Well, I think
because we think that's a very
Dr. Walks in
I'm sorry.
Too. I think Dr. Walks might be interested in that, especially the depression aspect of it.
The depression aspect. That's what we're looking at. Yeah, in particular. So Dr. Walks, I would like your number before we leave, and maybe you could join us in some of these discussions.
I will make sure that I get it to you, Dr. Gaston.
Yes.
Absolutely.
Thank you very much.
Dad, I'm seeing in the chat, there's a question from Dr. Sherrod asking about the prevalence of broken heart syndrome in Black women.
And also a question about turmeric. There is an
anti-inflammatory inflammation, right?
Okay, can I take the broken heart syndrome first? Many of you may not be familiar with that term, but there's a condition that was described in 1981 which is called Takatsubo disease. I don't want to get too fancy in regards to some of this kind of exotic cardiac disease, but Takatsubo disease was first described in Japan, as you might imagine. That's a Japanese term. And the term applies to an octopus trap. You know what an octopus is. You may not know the traps that are used to bring them in from the ocean. That trap looks like the lesion that occurs in the heart when this disease occurs in the patient. Let me get to the basics very quickly. The basic kind of person who develops this situation, this disease, is a woman, very often a Black woman, who is confronted with some violent situation. And Dr. Walks, you may be familiar with this, but it's something that is a reaction, a response to violence. It could be out in the community, it could be domestic violence, whatever. But the lady, and it's more often in 80% of the cases a woman, and most of the time a Black woman, who is confronted with a violent circumstance. And her reaction is a physiological one, which affects her heart. It leads to an actual constriction of the coronary vessels to the point that blood flow is decreased to the myocardium, or the heart muscle, essentially causing a heart attack. But it's a different kind of heart attack. It leads to the formation of a ventricular aneurysm, an outpouching or ballooning of the main pumping chamber of the heart, which can cause heart failure and death. It is not extremely common, but it's not rare either. And it's something that has not been researched sufficiently. It is not often recognized by most doctors who see patients who present with chest pain symptoms, shortness of breath, palpitations, and that sort of thing. Many of those doctors assume that this is the garden variety, what we call ACS, or acute coronary syndrome, whereas it is actually not. It is Takatsubo syndrome, and it has a specific treatment which needs to be given if the patient is to survive. So I hope that's enough of the description of the broken heart syndrome. It's called broken heart syndrome because of the fact that many of the women who develop this are confronted, as I said, with an emotional upsetting situation, which is said to lead to, quote, a broken heart.
Thank you. That's why you're my professor, Dr. Williams.
That's right.
We're almost at the end of our time. I want to give our speakers a chance to have a final word before Dr. Walks and I end up. So let's start with Dr. Danielle, who has a doctorate in theology. Is that correct?
Yes, theology and divinity, yes.
Okay. Give us some final words of wisdom.
Final words of wisdom: your closest helping hand is your own. Never forget that. You can go to your doctors, you can do everything else, but the lifestyle interventions are going to be the most important thing you can do. As Gerald spoke of today, Girl Trek and releasethepressure.org, and all of the things that you can do for yourself. I have to remind myself that there is a swimming pool in this high rise, and that I can walk up and down the hallways if I need to, if I'm afraid to walk around Hollywood Hills or whatever. There's always something you can do. And using therapy as a means to release the pressure, to speak of your problems, to talk about them, to not have shame, to know that that's a safe place where someone's holding space for you, to listen to you, and to not have a stigma attached to that. There's nothing wrong with it. It's very brave to speak about your problems, and it helps to release that burden and to lighten that load. So your closest helping hand is your own. That's always something I tell my patients, and that you can help yourself. I can help you. All of the doctors can help you, but you've got to help yourself.
Well, thank you so much. Dr. Gerald Bryant, and you might comment in a moment. I know that Suboxone and one of his Correlate's naloxone is being used for life extension now because it affects the immune receptor in a certain way. And another drug is metformin. But thank you for presenting today. I'd like to have some words of wisdom from you, Gerald. Is she here?
She is on mute. Can we unmute Gerald Bryant, please?
Gerald?
There we go. If we change the life of one Black female, we can change a generation. That is my takeaway message for you all to take back with you today. Take the pledge.
Excellent.
Thank you so much. And of course, my and Dr. Williams' hero, Dr. Marilyn Gaston, we're just so excited that you're on with us, Dr. Gaston. Would you have some final words?
I so enjoyed it. Well, I'm so excited about the campaign too. And Dr. Bryant, I need your contact information because I really want to be actively involved with Release the Pressure.
And I think
because there's no question. I'm sorry.
I think you should be involved as well. We definitely want to connect.
Yeah, thank you so much. I think it's so important. And we need exactly what you're doing, a huge national campaign to address all the aspects. I think we need the same thing in terms of a campaign in our Black community for our hypertension. We still aren't controlling it. There's still some practices that CDC has documented. They're in care, but they don't even know that they have hypertension or what to do. That was uncovered by the head of CDC maybe about 5 years ago. And that's when he decided to fund Million Hearts program. I know, Richard, you remember that. Yes. When he really made it a big deal and he tried to make it a national campaign. Mm-hmm. And I think we need to take charge of that. I think the NMA, all our Black organizations ought to really come together and have this be a priority, a major health priority, the obesity issues and the hypertension issues.
Dr. Gaston, when you were director of HRSA, how many health centers were you in charge of in the world?
Well, first of all, let me correct it. I love it that you gave me a promotion, but I wasn't. Does everybody know HRSA? HRSA, an agency that's in the public health service, like NIH, like CDC. It stands for Health Resources and Services Administration. And I was one of the bureau heads. I had the largest bureau. I had a $5 billion budget. And you know, as a Black woman, that was something to behold for all of us when that happened. But anyway, at that point, there were over, it was a huger network than the military, the military, the VA hospitals, et cetera. And we learned an awful lot. I hope all of you know about FQHCs, Federally Qualified Health Centers, that really our poor communities would have very little health. The disparities in our health outcomes would be even worse if it were not for these federally funded programs. And so we had like 15 million people that we were taking care of at the time I was there. And I so thank you, Randall, for mentioning that, because that's still a very important part of our healthcare system in this country. You know, we still have a healthcare system where we're #1 in costs and our outcomes are very, very poor compared to the rest of the world. So we still have a lot of work to do, as you know.
Yeah, I remember a proud but slightly embarrassing moment when I was trying to impress a friend and I walked into your office saying, I know the director of HRSA. And she says, hi, little Randy, how are you doing?
Oh, I didn't.
Dr. Richard.
I apologize. Did I do that? I was so excited to see you all grown up.
That's fine.
You know I'm messing with you, right? You know that.
Dr. Richard Williams, my professor.
Well,
I'm very proud of you and what you've accomplished in your career.
Well, thank you.
I'd like to save my final remarks by expressing my admiration again for Dr. Gaston. So happy that she came onto this program. And I wanted to mention something that many of you may not know about that she did to save thousands of lives of Black children with sickle cell anemia. Marilyn, I'd like just to salute you in a way that you have not been formally saluted before for your sterling research and work in regards to making antibiotic therapy available for children, infants with sickle cell, so that they would not develop pneumonia and die from that. At that time, pneumonia was the most common cause of death in children with sickle cell anemia.
And septicemia associated with it.
Yeah.
Well, thank you, but you know, I had all kinds of teams helping.
Yeah, but you were the one who came up with the idea, and you did not get sufficient mention for that. And by the way, in my new book, Blacks in Medicine, I have cited you for that particular accomplishment. That was a life-saving maneuver and something that you should have gotten more credit for. So I want to make sure that you receive that credit today.
Thank you very much. I want you to get a lot of credit for your Blacks in Medicine book, because I think that really fills an important void in terms of our history with medical care in this country. And I want to salute you for doing that. We needed a book like that. And thank you for putting me in it.
Very deservedly so.
Thank you.
Dr. Maxey is in it as well.
That's right, he is. Randall, congratulations. Yeah, I'm glad you're in it too.
Well, thank you. Thank you. My psychiatrist, Dr. Ivan Walks. How are you, man?
I'm doing better. There are several Black women in my family. I have 5 sisters, wife, 3 daughters, all of whom I want to share this information with because I think it matters. Oh, and don't let me forget mom, my mom.
Please don't.
And grandma.
Because Randall will run and tell on me if I leave mom out of anything, because Randall is her favorite doctor. But I want to use just a moment, Dr. Maxey, to join the Dr. Marilyn Gaston celebration tour. I remember working with Dr. Gaston when I was the chief health officer in Washington, D.C., and I was responsible for everything healthcare, from Medicaid and healthcare financing to maternal and child health and everything else. And Dr. Gaston was over at the federal government side and was always ready to step in and help and lead things like, I don't know if you remember the Back to Sleep program, Dr. Gaston, that you led, that helped us to lower infant mortality in the District of Columbia by more than 20% over the course of 1 year, to the lowest level in the history of Washington, D.C. That was some of the work that Dr. Gaston did. So she didn't
with
just show up
with a lot of hands and help.
Life-saving work.
No, Dr. Gaston, you've been saving Black lives and other lives for a long, long time, and I was privileged to be a member of your team back then, and to have you come into some of the stuff that we were doing in Washington, D.C. So you know I love you, and you know I just appreciate you.
And I love you.
And
I love everybody on this panel.
And I just wanted to say how excited I am to be with you, and of course, Dr. Richard Allen Williams and all the other folks who are here today. The next step, and I want to say this, Dr. Maxey, the next step, I think, is for us to get all of the members of our community to be excited about this. This information is huge. And as we work towards the next step, which is motivation, to get people to really embrace and engage on these issues that have been raised today, I know from personal experience that we can change health status tremendously in a short space of time. This is not, well, maybe by the 3rd generation. This is stuff that we can do in terms of measurable results in short periods of time. Every single life matters, and we can't afford to wait until next week. So I'm happy to be a part of this, what we've done today, and I'm looking forward to working with everybody. All the faces I can see, and all the ones that just have names up. All you guys, you're all in.
Great, thanks.
Thank
Let's
you.
make it happen.
Well, this is so important today, and people may say, why is it such a big deal? Having Dr. Gaston is a big deal, and all of us who are trained in medicine know that it's a big deal. So it's so well deserved, and we're just proud that you chose to join us today, and we hope you come back more.
Thank you. I will. And thank you, Randall, for having this, because I know how hard you've worked to keep this up and running, and it's been wonderful. Thanks so much.
Well,
It's made a major contribution.
Well, thank you. So we're at the end of our time. I'd like to say one more thing. Danielle, one day I want my young daughter, who's a physician, to smile and look at me just like you're looking at your dad. That's great.
He's my everything. He knows it.
I do.
That's
Danielle, I'm going to call you.
Please do.
Okay.
If you would like to reach me, by the way, my website is Danielle Delaney, DELANEY, counseling, COUNSELING @.com. Just DanielleDelaneyCounseling.com. And I'll put my phone number in the chat. I think I put it in there earlier, but
good.
And
right here. So anything I can be helpful with, I just put it there. It's my direct text and phone number.
And
Thank you for having me.
Dorothy,
Gerald, you need to supply your information to Dr. Gaston, Gerald.
Mr. Dorsey, are you on?
I did see Mr. Dorsey on earlier.
Okay, there's information in the chat if he's not on about.
He's on, Dr. Maxey.
Mr. Dorsey, would you speak to us for a few minutes, a second, brother?
It looks like his audio is having trouble connecting.
Okay.
He's not on mute. I just think I see the audio is having trouble.
Do you mind speaking about his machine just a moment? I'm still interested in making sure as many of us as can get a hold of that technology.
I don't mind at all. Dr. Maxey, Mr. Dorsey had come on. It's been, I guess, a few months ago now, and shared with us some technology that is available for helping to clear the air of viruses, including the COVID-19 coronavirus and other things that can harm us. And Dr. Maxey and I decided we needed to protect our families as much as we could. Now, I can't see the little particles in the air, and I can't see what the machine is doing, but nobody in my house has gotten sick, and we've had a few people over, and we power up the machines, and everybody's still healthy. So Mr. Dorsey, I want to thank you for making that available for us. Our resident virologist and scientist on the Black Health Trust did also look over the technology and felt that it was effective. So Mr. Dorsey, I know, put the information. Oh, there you are, sir.
Yes. You've often heard me mention that this technology was derived from NASA. About a month ago, NASA released an article about technologies that are spinoffs from what they have developed. I put the link to that document in the chat, and along with my contact information. If anyone else needs any additional information, please feel free.
Thank you. And before we go, I'd like to have a brief report from what's going on in Jamaica, in Kingston. Is Dr. Dawes still on?
I do see Dr. Dawes on, Dr. Lisa Kerbin Dawes, if we could unmute Dr. Dawes. There she goes.
In Jamaica, we actually have a high mortality from strokes, even higher than heart attack. We do see a fair amount of broken heart syndrome. Usually though, it's from women in abusive family situations. We are having a lot of stress in our women, in our faculty, in our in our frontline workers. And in Jamaica, most of our frontline workers are women. So I was actually interested in seeing if we could get some help here. I also have, my daughter is in New York now, actually in school. And what I'm realizing is not just her, but several of them in college, and these are mostly girls, are very, very stressed out. And they're having they have insurance, and they're having a hard time getting referrals to actually talk to people or even see a psychiatrist.
Wow.
Which is why initially I put in the chat, how difficult is it there? Because I was very surprised that they were having that issue. One of her friends have tried to get a referral 3 times because she's having anxiety attacks. And as Danielle had said, one of the doctors said, oh, she could just take a Xanax. But the child isn't sleeping. And I'm surprised that this is still happening in the US. But how do you help all these young people who are in college? So that's one issue. And we don't have very good psychiatric care in Jamaica. Oh God, this is like being recorded. But psychiatrists are not covered very well here by insurance. And for the government, I think we have probably 4 psychiatrists for all the hospitals that are paid by government. So there are huge clinics. And we are seeing I had an 18-year-old commit suicide that we couldn't save from an overdose on herbicide a few days ago.
So sorry.
So we do need to reach them. I am not sure what to do. I know we need help, both here and abroad. And these are Black people or young Black people.
Just for
So I don't think it's just menopausal. I think that is a high stress on women in general, and added to everything else. I think in minority families, we don't have the support that women should. But also I'm seeing it, I think because I have young people in college and the kids come talk to me, I'm seeing it so much in the college children.
So Dr. Kervin, just for the record, tell us who you are.
I am Dr. Kervin Dawes. I went to school in the US. I practice in Jamaica. I have several titles here. I have an MD, MPH. I am head of infection control. I am also vice president of Jamaica Midlife Association. I have a number of titles, internal medicine consultants. I teach for several medical schools.
And I do believe that many people in the NMA, and I'm gonna get Dr. Williams to pay my way, they're having a Region 1 conference in Jamaica at the Half Moon, I think.
Yes.
Last week in May. I'll be there. And
May
Dr. Williams,
I'm one of the speakers, yes.
Dr. Williams is going to pay me a first-class ticket to get there. Well, thanks, everybody. Thanks for your cooperation.
But if you can help, I'm really serious. When I come on this, and I think Randall hates asking me to say anything because I'm usually asking for help because we do have a lot of issues.
No, and actually, I was going to talk to Dr. Walks about giving you a call and seeing how he could.
Yeah, I think I spoke to Randall about it earlier, that it's a problem right now.
Let me, Randall, let me just
I'd like to make a suggestion that when you bring this problem up at the Region 1 conference in Jamaica on May 26th or 27th. I'll be there, but I think that you would be the perfect person to present that to Region 1 of NMA and ask them directly for some help with that problem.
Well, we need some help here as well, but I am also saying in the US, because that I was surprised in talking to them in New York that they were having such difficulty access. I mean, my daughter is at NYU and their friends are talking about it, that they're having difficulty accessing help. And I'm very surprised.
So let me just jump in and say a couple of things real quick. Dr. Lisa, Dr. Villanueva did put something in the chat, a referral to find mental health services in New York City. And Lisa, you know how to reach me. I'm happy to communicate with you and talk to some other folks that I know to see if we can get some more immediate connections for you in that area. And then unlike Dr. Maxey, I'm willing to fly coach to come to Jamaica. So with all seriousness, I'm happy to help
Actually,
in
you
any
guys
way I
should
can.
all come, but you know you can write it off because it's all tax deductible because it provides CME as well. But if you do come, there are some beautiful sites that I'll make sure you see. There are a lot of beautiful things, and I'll make sure if you have the time, I will make time to make sure you visit some of them.
Let me, okay, Dr. Maxey, before you get me in trouble again, let me say seriously, mental health issues are particularly challenging, particularly in some parts of our diaspora. And I know because my brother has lived in Jamaica for the last 40 years, Jamaica is not a place where mental health is easily talked about and dealt with, and it's ordinary and normal. And so we definitely want to help in any way that we can. So Lisa, you and I can connect, and I'll see if I can have a conversation with you about how we can move things forward, in addition to the Region 1 meeting.
And I'd like to give a chance to our national president, if she's on. Dr. Rachel Villanueva, would you please have a word before we close?
Let's see if we can get Dr. Villanueva unmuted. There we go.
Hi, I'm sorry, my phone is, I just walked in from the train, so my phone is about to die. I just want to plug it in. No, I wanted to say it was obviously a great program as always. I would like to say, you know, NMA has been very active in the Release the Pressure campaign, and we are involved in helping to expand the campaign moving forward. So we have some exciting things that will be coming up, but whoever is interested in being a part of the Release the Pressure campaign, it would be great to have more individuals that are able to speak for the campaign. So if anyone is interested, they can give me their contact and I'd be happy to point you in the right direction.
And Rachel,
but again,
what is your job this year?
My job in the Release the Pressure campaign?
No, the National Medical Association.
Oh, I'm so sorry. I thought you said it. I'm the national president of NMA this year for about 6 more months. and then I hand it over to another Region 1.
And you have a colloquium coming up in March, right?
I do. Our colloquium on African American health, which will be centering equity from policy to practice, will be our first in-person meeting in over 2 years. So we're very excited about that. It will also be live streamed, and that's March 25th through the 27th in Washington, D.C.
And the person who invented that colloquium is on today, I believe, Dr. Gary Dennis.
Dennis? Is Dr. Dennis on? Yes, we're so thankful for that.
He was earlier.
It's such an important part of NMA's history and legacy, and we have a very exciting program for this year, so we're excited about it.
And where are we going to be in August or July?
We will be in Atlanta for our national convention. It will also be a hybrid, so it will be in person and live streamed, and that will be July 30th through August 3rd. Any in-person attendees must be both vaccinated and boosted if they're eligible to be boosted by that time. So we just want to make sure that that is clear for everyone wanting to attend.
Well, excellent. Well, thank you, Dr. Ivan Walks. I think we're done. I don't think we left anybody out. I don't see Dr. Pointer, but we welcome everybody to be back with us every Sunday. We're here without fail, and we thank Dr. Walks, Dr. Joycelyn Hines, and Dr. Barbara Davis-Stevens, and Dr. Williams. Your program was excellent today. Everybody have a very, very good evening and be safe.
Thank you.
Thank you, everybody. God bless.